Hi, I'm here with Dr. Michael Harbour of Stanford University School of Medicine, whose Palo Alto practice supports many in our community living with AIDS and HIV. Welcome, Dr. Harbour.
Hi, Jay. Thanks for having me.
Dr. Harbour, what have you been doing and what's the latest in HIV medications these days?
Well, the field of HIV has changed a lot over the past 2 years or so since a lot of new medications have been approved. There are some new classes of medications to treat HIV. Many of them are more potent than the previous medications. There are less side effects, and they offer a lot of hope to patients who have never been on therapy, or those who have been on therapy and have experienced resistance. So they can be used both ways.
Now, I know that a lot of people are interested in a cure or vaccine. Can you tell us anything about that?
Well, in terms of the cure, that's one of the most common questions I get asked regularly. And there is no cure on the horizon at this point. It's really maintenance of low HIV viremia to keep the virus at bay and to support the immune system. With regard to vaccine therapies, there have been a number of vaccines that have come into development. Unfortunately, they have not been effective. They've been no better than placebo. And they're still looking at hundreds of different vaccines, but it's going to be a long time off.
So in terms of like money and paying for something like this, is this something that a clinic, if you have HIV too, that they could give you any kind of support, or how does the government work with that?
Well, most of the research protocols and big research designs are supported through the National Institutes of Health out of Washington. The CDC in Atlanta also supports different research projects that go on. There are a number of private organizations and companies that are invested in trying to be the first to bring a vaccine to cure to practice as well. And then many of the pharmaceutical companies as well are developing new medicines that treat HIV more effectively, hopefully with less side effects, less times per day in terms of dosing, etc.
So I've heard that there's actually a single pill that you can take now per day, and
right.
And
so the single pill that's available is actually a combination of drugs that had already been existing. So they're not new medications, but the formulation of which is new. And it's nice to be able to take that entire complete cocktail in just one pill once per day. And many patients are very happy about that. It certainly makes their lives easier and gives the sense that they're not quite as sick.
Now, I saw something in the Wall Street Journal recently, it was November 7th issue, where they were saying there was a therapy, CCR5 receptor therapy. I guess it included bone marrow. Do you know anything about that? Or?
Well, there's been a number of different studies that have looked at trying to maybe incorporate different techniques that we use for cancer in the treatment of HIV, gene therapy, which we've been involved with at Stanford as well. But the CCR5 inhibitor, what you talk of, it's actually a receptor on the white blood cell, the T cell, that the HIV virus actually infects. And these are molecules that block the HIV virus from getting inside the T cell. And people often think, oh, is that a better way to treat the virus? Well, you have to remember that somebody's already been infected by the time we're looking at different treatments. So it's not actually blocking infection into the body, it's just a different place in the whole schematic that we start treatment for patients.
So, I mean, then there are people who have a natural immunity, as I understand, because they don't have that receptor available. But you told me earlier that there were some people that probably think that they had this immunity when there's a false sense of security.
There are some patients with genetic predisposition to not get infected. But these patients are few and far between. There's no reason to stop having safe sex by thinking that you haven't been exposed to it in the past, so you're probably not going to get it in the future. So I want to make sure that people know that they can't count on having that genetic deletion.
And you were saying that the Bay Area itself is like there's a methamphetamine problem and that's associated with high rates of HIV infection.
Right. So methamphetamine is probably one of the most addictive drugs around. It's cheap, it's available, and when patients are using methamphetamine, their sexual proclivity increases and they put themselves at risk. And we often see those who are using and abusing methamphetamine also becoming newly infected with HIV.
And in terms of the latest, you got an award now in May for
I did,
Doctor
yes.
of the Year.
Well, it wasn't quite Doctor of the Year, but the Silicon Valley AIDS Coalition that puts on the AIDS Walk awarded me with their award of distinction. And actually, that was probably one of the nicest awards I've ever gotten, coming from colleagues and the community for taking care of patients with HIV. So
now we have people who want to contact you. I think we'll have that on the screen for us. And I thank you for joining us and giving us the update.
Thanks for having me.
Thanks.